Well, October 20th was World Osteoporosis Day. November is Osteoporosis Month. And to mark the occasion, there's a new book out called The Osteoporosis Book. It's the third edition, so there have been two others before this, but it's been quite a few years since the last edition. So a lot of updating has happened to this book. Dr. Alan Lowe is one of the authors of this book, along with Gwen Ellert and John Wade. And Alan, you're a pharmacist, and so one of the big changes to this current edition is the number of new medications, new treatments for osteoporosis patients. Is that right?
Absolutely, Sophia. There's been a lot of progress in osteoporosis therapies, lots of options available. And certainly the usual is going to be the diet, the lifestyle changes, and the exercise. But of course, once we get into a higher risk patient, then other options become a necessity, and these include the medications. And there has been some new medications that have come out in the last few years.
Okay, so let's talk about those who are at risk. Or, I mean, we tend to think of osteoporosis as something that older, particularly women, have to worry about. But is it something that younger women or men need to start thinking about at a younger age?
Definitely. I think osteoporosis prevention needs to start very early, and I think that's part of the empowerment in this book, is to educate folks on what they need to do, not only for themselves, but for their family. So osteoporosis is a thinning of bones that occurs, and it's a thinning of bones to the point where the risk of fracture is quite high. And the prevention, such as building peak bone mass or strong bones, occurs when you're young. Usually you peak out your bone mass between 15 and 25 years old. So it means you got to start early.
So it's all downhill after 25?
Unfortunately,
for so many
it's kind
reasons.
of downhill. And so you can maintain what you have, and certainly some of the medications do help build it up. But it is something that we do need to focus on and certainly start very early. So even with my kids, I've got them taking calcium because they don't drink as much milk as, we hope that they do. So
Do you even have your kids taking calcium?
Absolutely. And
how much? What age?
Well, depending on different ages, there's a different requirement. So really, there's some recommendations in the book that give you a breakdown of depending on your age. But for women who are 50 and older, the aim is to be 1,000 milligrams to 1,200 milligrams of elemental calcium. So that's kind of the basic requirement. When you add up what you take for supplement as well as what you're taking with your diet as well too. So you do get some calcium in your diet. Most of it comes from dairy products. Unfortunately, a lot of folks, as we get older, we have less and less dairy products.
So you need to find it elsewhere. So you also mentioned involving your family or getting your, I think that was one of the things that you'd said. So what do you mean by that?
Well, I guess getting everybody enthusiastic and aware of what they need to do to keep their bones strong. So there's been studies done where it's a program in BC called Jump at the Bell. And kids who, when the bell rings, they jump for a minute or two, and that's been shown to increase their bone density. So it starts very early. And again, with kids not drinking their milk, certainly encouraging them to get that calcium. And if they either are intolerant to milk because of lactose intolerance or don't like milk, then there's calcium supplements. There's all sorts of great ones out there. There's chewable, there's liquids, there's all sorts. But of course, it's also important for adults as well. It starts in childhood, but we do need to keep it going as we get older.
Okay. So you'd also talked about, we had talked about the progress that's been made in some of the medications out there, and that's also, your area of expertise and a good chunk of this book. So what kind of progress has been made? And who is it for? Is it for those who are at an advanced stage, or is it preventative?
Right. The progress is generally in those at higher risk of osteoporosis. So generally speaking, women over 50 have a 40% chance of actually fracturing a bone. So that is quite high. And if you look at the actual numbers, we're talking 1 in 4 women currently over 50 have osteoporosis, and 1 in 8 men. So it is very common. And the work is towards trying to reduce the fracture rate as much as possible. So it's preventing that fracture. So there's been a number of medications that have been coming out. Some are anabolic. That means they build new bone. That's been a first. We haven't had drugs that actually build new bones. What we've generally had is drugs that will prevent the breakdown of bone. So they're anti-resorptives. And that means that they slow down that breakdown. Because like I said, after a certain age, around 15 to 25, it's downhill, and your bone actually thins over time.
So the building new bone would sound to me like it would be a last resort.
It's not necessarily a last resort. It is meant for those that are at higher risk, but not necessarily a last resort. It is a more expensive medication that builds bone, and that's why sometimes people will treat it as kind of a last resort.
And what about those who do have osteoporosis? Is there new treatment for them who are actually living with it day to day?
There are new treatments, and this book is certainly something that would help out. It empowers the patient to ask the right questions with their doctor. It empowers the patient to understand which options are available to them. Osteoporosis has a number of different options available, and these medications will help those folks as well too. The risk of osteoporosis and its devastation afterwards is just incredible. I mean, 1 in 3 women who fracture a hip will actually, they'll die according to the statistics.
Yeah, you hear that all too often.
And of the half the people that survive it, they end up in nursing homes or a rehabilitation center or re-hospitalized somewhere else. So it has a significant impact on our society and the economics as well.
Thanks very much, Alan. Dr.
you.
Alan Lowe, one of the 3 authors of the Osteoporosis book, the 3rd edition for your bone health. And you can, of course, get it at all bookstores in Vancouver. Thank you very much. Good night to be a Vancouver sports fan. The Lions and the Canucks both at home last night. Chanel has highlights for you coming up.